My name is Colby Presley, and I'll be presenting on Frederic Edward Mohs, or more commonly we'll just call him Mohs during this presentation. He's a historical figure in the field of dermatology. He is the one who created Mohs surgery. It's one of the most popular and most used techniques now to remove melanoma and carcinoma. But I'm going to take you kind of on the journey path that Dr. Mohs had to follow in order to become one of the most renowned dermatologists and the one who helped cure a lot of skin cancer. So, for Frederic Edward Mohs, in his early life, he was born March 1st, 1910 in Burlington, Wisconsin. His father was an engineer and died when Frederic was only 3 years old. And after his father had died, the family relocated to Madison, Wisconsin, where the University of Wisconsin-Madison is located. And Mohs was determined to become a radio engineer. He wanted to follow the footsteps of his father. He had no interest at the time to be a doctor. He had no interest in medicine. He was really focused on becoming a radio engineer. But during his college years, he changed career paths, and as he deemed in his biography, he fell in love with the art of medicine. So Dr. Mohs, he attended the University of Wisconsin-Madison Medical School. Today is still one of the most renowned medical schools. And he received his doctorate of medicine in 1934. During his medical education, he did have to take a 1-year gap, something that's very unheard of now and back then. I think if you were to do it now, a medical school would not re-accept you. But during the Great Depression, his family was suffering very much financially, and he had to take a break for 1 year and help support his mother and his siblings. Mohs would graduate in 1934, and that's a picture of this stud right here when he received his MD. And he would continue with research after his graduation in dermatology at the University of Wisconsin-Madison. His groundbreaking research, he worked with the tissue of animals, which is most commonly done with rats and with puppies. And what Mohs was doing is he discovered a zinc chloride solution that if he used it to remove tissue from the organism, it would maintain its structure so that he could pathologically research and look at it under a microscope. And so he would use that zinc chloride solution so that the cell would maintain its structure, and then he would remove layer of the skin cancer and make it hold within the microscope so that he could determine whether or not the skin cancer had been removed by each layer that he removed of the skin. And Mohs continued to use this technique in his research, and then he started to use it in skin cancer patients, cutting layer by layer and examining each layer pathologically. This type of technique that he would use became known as chemosurgery because of the use of the zinc chloride. And this process for the layer by layer dissection of the cancer skin allowed for Mohs to not only get rid of the rogue cell, but maintain all the healthy cells that were still available. So if you had a cancerous cell right here, he would come along and he would cut it in a very oval shape to only remove the skin cancer while trying to preserve all the healthy tissue that was available. During that time, dermatologists were just scraping out large parts of tissue, hoping that they got all of the skin cancer. But while doing so, they would remove so much tissue that you would see a lot of scar tissue, or you would see a big old gouge within the patient's face because they were removing all of that extra tissue that didn't have to be removed. So very wasn't aesthetically pleasing, the technique that they had. So the process was used mainly in the facial area, and it was just a full elimination process, removing 100% of the cancerous tissues while not removing healthy tissues. The problem with chemosurgery was that it was a lengthy process. So Dr. Mohs would have to remove the tissue, and he would have to do the pathology under that zinc chloride, and then he would take a day or two to process whether or not he had got all the skin cancer. So as a patient, you were coming in to see your dermatologist, and he was able to remove the tissue and determine whether it had skin cancer, but it took him a day, so you'd have to come back the next day. He might have to cut more. If he had to cut again, it was, once again, a longer process. The longer process ever recorded was 37 days, but most commonly the average was 4 to 6 days. That was not popular among dermatologists because it was taking too much time. So while it may have saved the aesthetics of a person's face, it was just too long of a process. But he began to gain slow popularity because dermatologists that dealt with skin cancer saw the importance of chemosurgery, and especially in Europe, they saw that maybe it's better if we don't remove these huge amount of healthy tissue and actually just focus on only getting out the cancer cells. It gained so much popularity that the first fellowship in chemosurgery was put into effect at NYU in 1968. So slowly but surely, Mohs began to gain popularity, but then he developed a new technique, something that wouldn't take as much time. So instead of using the zinc chloride solution, which would hold the shape, he just started doing a fresh cut. So no more zinc chloride because it was causing irritation on a lot of people's skin, and he was able to just do a fresh cut using anesthetics locally, and then he prepared the pathology immediately so that he would know whether or not he removed all the skin cancer. This allowed for Mohs to know within the hour if he needed to make more excisions or if he had gotten all the cancer and the patient was able to leave for the day. With Mohs being able to remove all the cancer within 1 day, he gained more and more popularity. The fresh cut technique is what the term was, how it was coined, and it began to be used all over the body, beyond the face. So he would be doing removals on shoulders and backs and wherever else in the body using his fresh cut technique and knowing whether he'd got all the cancer. So he started to gain ground, and he became so popular that dermatologists began to have him teach and write books of his surgical techniques so that he could remove all of the cancer. Today there are over 900 members of the American College of Mohs Surgery, 900 members of a certain technique just in dermatology. Post-residency fellowships are now available in Mohs surgery, in pathology, and reconstructive surgery. So doctors now have to learn Mohs. This technique is so popular and so effective in how it removes skin cancer. Chemosurgery was no longer the term that was used once they began to use the fresh cut technique. The term evolved into Mohs micrographic surgery, which then became Mohs surgery, and then just Mohs for short. When I would shadow at Cedar Dermatology, it was great because Dr. Adams would just say, hey, we're going to do a Mohs today. Be prepared, we'll be here for a little while. So Mohs is the most common term used for Dr. Mohs' technique. While Mohs was only used to treat carcinoma within patients, it's evolved and now it's used to treat melanoma, and it's actually one of the most common ways to treat melanoma as long as it hasn't rooted too far within the skin. So, success for his hard work, So, in 1985, President Ronald Reagan, who had skin cancer, had specifically his dermatologist said, we have to remove this through Mohs. So that's one of the most popular methods. That's where he gained a lot of popularity, especially in 1985 for all of his work. And Dr. Hubert T. Greenway, president of the American College of Mohs Micrographic Surgery and Cutaneous Oncology in Illinois, and which was founded by Dr. Mohs in 1967, said that the Mohs techniques, while initially controversial, are now a recognized treatment which can have a cure rate of up to 99% of certain skin cancers. This is a huge curing technique thanks to Dr. Mohs. Dr. Mohs did have a life beyond what his techniques that he was able to develop. He married in 1943 to Mary Ellen Reynolds, and they had 2 children, they had 3 children, 2 sons and a daughter. And Mary Ellen passed away in 1995, and 7 years later, Dr. Mohs himself would pass away in 2002, still being one of the most celebrated dermatologists in his field. He is survived by his 2 sons and his daughter, none of which are practicing physicians or actually have nothing to do with the medical field. So Dr. Mohs is the one who set all the ground within the dermatology community to help cure skin cancer through Mohs surgery.